Hey guys, hi. Vinayak here. So I hope all of you have done very well in your NEET SS. It was a tough exam, but don't worry, your INISS is tough to come down significantly. So I'm sure you all will have done, you all will get a good rank. And one thing I must tell you about NEET SS is that, a lot of you gave me feedback that about 20, 30 questions came from the Surgtest question bank directly. But one thing I'll assure you is that for INISS, that percentage is going to be higher. There are less people in the old pattern of NEET SS where you had to prepare for the specialty and general surgery. INISS was very competitive because the preparation was similar to NEET SS. But currently, with the current pattern where you will have to study for GI separately, general surgery separately, or Onco separately and general surgery separately, the amount of people writing INISS has decreased significantly. Number two, people lack the motivation to study for INISS the next 1 month. So if you're smart, I genuinely feel you can crack INISS, GI, and Onco. And this is based on experience of the toppers who have cleared previously. So coming to GI surgery first, there are only two textbooks, Shackleford and Blumgart. But Sabiston 21st edition is also gold. So you have a significant edge in preparation if you have read GI surgery part, including liver transplant and pancreatic transplant from Sabiston. If you are not in the mood to read anything else, touch Shackleford or Blumgart, I would advise you the simplest way is to completely finish reading Sabiston 21st edition, GI surgery, and the transplant part. Okay, first step. General surgery part, don't waste time revising stuff from textbook. Solve the GI, general surgery MCQ bank multiple, at least once before going in for your INSS, because that 20% marks is going to make a hell lot of difference. As you know, INSS, 20% of the questions are going to be from general surgery, 80% of the questions are going to be from the topic. So approximately you can say of the other 80 questions, 20 to 25 questions, less than 20 to 25 questions will be from general surgery, 60 questions are going to be from GI surgery. So for people who have already read important topics from Shackleford and Blumgart, great, but it's going to be very tough for you to do it. So my personal advice, just go skim through tables of Shackleford and Blumgart. Even that is going to be a considerably difficult task. My personal advice would be to sit down and solve the GI surgery MCQ bank at least once. There are more than 3,000 questions. It's not going to be easy for you to solve it twice or thrice, but at least once, if you're able to solve it, you have a significant edge. If you're willing to spend at least 8 to 10 hours a day studying for your GI surgery, INSS, my personal advice would be to use the GI surgery INSS video lectures, which are from the latest textbooks, both the latest editions of Shackleford and Blumgart. They have condensed all the important points necessary for INSS in the video lecture. So that is going to be a very crucial resource. If you are able to view the video lectures once, and if you're able to solve the MCQ bank at least once, you are in serious contention for the exam. Okay. So that is my personal advice. Next, coming to Onco. Onco is going to be the easiest topic to clear because there have been a lot of topics which you have already covered from your general surgery part. You have read a lot of parts of the oncology. There have been people who have just done NEET SS really well. With the knowledge from NEET SS, they've gone and done their Onco exams and they have been able to get a decent rank. But my advice would be, if you have time, read MD Anderson, textbook of surgical oncology. MD Anderson. Just make a note, it's MD Anderson. And that is going to be the simplest textbook for you to read. And that's going to be the easiest resource for you to clear your INSS surgical onco. So if you're able to master it, most of the concepts which are important in oncology will be covered in this thing. Do not waste time reading DeVita because reading DeVita is going to be very difficult. Also use the time to solve MCQs from the Surgtest INISS Oncosurgery question bank, which is pretty much updated according to the latest standard textbooks. Also, the NCCN guidelines are updated. So, because the NCCN guidelines are updated almost as recently as possible, you will be able to crack most of the questions. We have temporarily deactivated the INISS surgical onco video lectures, but we are planning to reactivate it. Those are a little dated. Those are from 2020-21. We are reshooting it. But if you guys are interested, you can subscribe to it because the concepts in head and neck, breast, and onco are very detailed in that. But certain concepts might be a little outdated, but they will help you understand the concepts. So, certain points will be outdated. So, for example, 95% of the video lectures will be relevant. Only 5% of the video lectures may not be, might have changed, but that does not make a huge difference in your preparation. So, if you're interested, you can subscribe to that. We will reactivate it by tonight. We have just temporarily deactivated on the Surgtest app. So, I'm going to stop now. This is the simple gist of how you should be preparing for your GI surgery or in your onco surgery INISS. So if you have any doubts, I think guys will have a lot of doubts to ask, and I'm going to use the next 20 minutes to answer your doubts. Yeah. Role of previous year question for gastro. It is important, but almost 70% of the previous year's questions are there in the question bank itself. To maintain NB confidentiality, we have not mentioned which is the PYQ, but we have been including all the previous year question bank questions in the MCQ bank itself. So urology, I'll be covering it in a separate session. But urology, just to, a lot of people have been asking me about urology. If you want to read urology, you will have to read Campbell, but Campbell reading is going to be super difficult right now. For me, I would say the Surgtest MCQ bank for urology is super comprehensive. It has been prepared by a very brilliant urologist, Dr. Dheeraj Kannan. And he has done a fantastic job at it. People have just used the question bank and gotten in the top 10 ranks. So that's something which I can assure you. So one question. How often questions are repeated in GI? Not so often. The concepts are repeated. The questions are not exactly repeated. So next question. A lot of questions in the question bank are not updated as per 12th edition DeVita. See, we have updated according to the latest edition of, right now, if you check the question bank, it's almost latest updated according to the latest MD Anderson. Some of the questions are from 11th edition DeVita, but those are all concepts which are based on the, for example, from the basics of oncology, that part of chapters. All the questions in management are almost, all of them are recently updated. Tentative date, we really don't know, but we don't expect the date to be postponed too much. It will be at the end of April for sure. How many days of preparation? If you're able to study for 8 hours a day, I think about 20-25 days will be enough for you to crack INISS, but provided you have studied reasonably well for NEET SS. So, neurosurgery, CTVS, I'll be covering it in a separate session. So, important general surgery topics for gastro. See, AIMS love to ask questions on perioperative care, trauma. You can expect a significant amount of questions. And even in the general surgery part, you can expect questions from endoscopy, imaging, and all that sort of topics. So that is something you can expect. Pediatric surgery also is a favorite topic in INIS's general surgery part. So read it from Bailey. You don't need to read it from any other part. Trauma surgery. So yes, the GI surgery question bank is recently updated. A few questions from Blumgart need to be updated, but the Shackleford latest edition has been updated completely. Blumgart also, the updates, we will try to do it within the next 1 week. So someone has told me that they're inspired by NEET essays and are planning to take CVTS. Great. Now, I don't know if that is sarcasm or reality, but yes. Will Sabiston revising and Bailey general part be sufficient? Yes, for the general surgery part, yes. But if you want to crack the GI surgery part or the onco surgery part, you will need to read solve the question bank at least from the standard textbook. So trauma surgery paper to read GI and onco or not? Hey, see, general surgery questions you will have to revise. They can ask. There is no a specific thing. Okay, so there's one question. What are the articles to read for GI surgery? So there is something called as the AIMS GI surgery update. I'll just try to see if I can, send a link or show you this thing. AIMS GI surgery update. It's not AIMS GI surgery, or is the IA ASG? I will just try to find out and send that link as well. There is an AIMS Indian Society of Surgical Gastroenterology. They will have an update paper. Every year they create. I don't know if it's available on Amazon. It used to be available when I was preparing for the entrances. So they have specific topics which are which are important for your, from an update point of view. So it's called the AIMS JS update. It used to be published by Dr. Piyush Saini. So I think that is a very useful textbook for you to read for your INISS GI surgery part. There's something for Onco, nothing very similar for Onco, to be honest. But Onco, for me, I would say, because the topic is too wide, I would say if you're able to read MD Anderson 7th edition, then that is, that is a huge thing. See, CVTS, neurosurgery, urology, I will cover on Monday. I will have a separate session where you guys can join, including pediatric surgery. I will talk about it separately. So, so people have joined late and they're asking me how to approach for gastrosurgery. So I'm going to talk about it again. So for gastrosurgery, the general surgery part, revise only the MCQs from the Surgtest app. You don't have time to read the entire Bailey and Love. If you want to read a textbook, read the Sabiston GI surgery part in detail along with transplant. For people who have already spent some time reading Shackleford or Blumgart, great, but it's not going to be easy for everyone. If you're super motivated, you can look at the tables of Shackleford and Blumgart. AIMS GI surgery update, or I think it's called IASG updates by Dr. Piyush Sani. That is a good textbook. Few articles you can skim through. At least last 2-3 years updates you can read. Surgtest MCQ bank, around 3,000 questions. Super duper useful. That will be a game changer. Questions and the concepts will be directly lifted from the question bank. That is something I can assure you. The GI surgery video lectures will be super useful in understanding the concept, especially colorectal, MRI of MRI in CA rectum, pancreatic cancer, pancreatic neuroendocrine tumors. Those topics you will get a significant advantage if you use the GI surgery video lectures. So yes, that is the approach for GI surgery. Yes, such as MCQ from gastrosurgery is quite comprehensive. So again, neurosurgery, plastic, pediatric, and this thing, I'll talk about it on Monday. We'll have a separate session. Monday or Tuesday, we'll definitely have a separate session. So I'm going to restrict this topic to GI and Onco only. So I have a question. Is it possible to have a decent attempt at GI if you're seriously prepared for NEET assess with focus on GI this month alone? Yes, absolutely possible. If I can assure you one thing, if you are able to see the video lectures once, spend time solving the question bank at least once, solve it in practice mode, go topic by topic. If you're decently prepared for general surgery before for your NEET assess, you have a good chance of being in the top 10 to 15 ranks. If you have even more time to read the Piyush Sani book, which is like articles, specific topics, and also revise the tables from Shackleford and Blumgart, which is not going to be easy because it's a big textbook. You have a very, very, very solid chance at cracking the top 5 ranks in INISS GI surgery. Oh yeah, this is the book. It's called the GI Surgery Annual. Piyush Sani and Sujay Pal. Yeah. So I will just put it out under this thing. Put it out in the chat. So if you're able to read at least 2 to 3 editions, like volume 20, 26, 24, 25, 26, then that is great. Regarding urology, endocrine, I will be talking on Monday, but endocrine surgery, a lot of people who are prepared for Onco are shifting to endocrine this year. For endocrine, it's going to be very difficult for you to spend time reading standard textbooks. We don't have a separate MCQ bank for it. But if you're able to read Schwartz endocrine surgery part, then I think you are in a good position overall. I think you are in a good position overall. Schwartz endocrine surgery is great. So yeah, for surgical onco, solving the Surgtest question bank and few concepts in MD Anderson is enough. or do we need to do full MD Anderson? See, ideally, if you have time, read the MD Anderson textbook. It can be finished in 15 days. MD Anderson 7th edition is the latest edition, and it can be finished in 15 days. I have done it. When I created the Surgtest MCQ Bank, I read the 6th edition, and I literally finished it in 10 to 15 days. And I can assure you, I was also working at that point of time. Me and Dr. Gopi, founders of, and the co-founder of Surgtest, we actually read it. We used to travel by train every day from. We were working as assistant professors in a small medical college after general surgery. When we were creating the MCQ Bank, we literally used to read the textbook on the way in the train and while returning back, and we were able to finish it in 15 to 20 days. It's the easiest textbook to read. It's very simple. The GI surgery MCQ Bank is updated. Almost 90% is updated. Shackleford, all references are latest. A few references from Blumgart need to be updated, and that is something we will be doing in the next few days. The all the ND and the even for surgical onco, almost all references are updated except a few references in the GI surgery part of onco. And that's also something we'll be doing in the next 10 days, so 5 to 7 days. See, I don't have a specific exam strategy. It's a very small exam. It's just 80 questions. You know it, you will be able to answer it. Trust your instincts and trust your common sense. A lot of questions will be clinical based. There are going to be images. One thing which I'll advise you is that skim through the Blumgart images. Blumgart HPB images, just skim through. There will be a few questions lifted directly from the images in Blumgart HPB part. See, I'm not I'm not the INISS authority, so I don't think I'll be able to confirm the date or anything of that sort. So yeah. No, you can go through it if you have time, but it's going to be super difficult, and they don't ask too many questions from the tables directly from debate. So someone has asked me whether you need to go through Devita tables. So I'm answering that there's a lot of tables. I don't know if you'll be able to have the time to do that. Guys, please post the questions in the group itself. When you ask in direct message, it gets difficult for me to respond also. Direct the questions for everyone. So any other doubt, guys, feel free. You can ask it in the groups itself. I'll be willing to more than help you out with that. So Shreyas has asked me at the end of session, when will be the next NEET assess? See, I expect it to be by October, November. So you guys have to have time. So reading Sabiston and solving the GS Searches GI question bank, that's going to be quite sufficient, to be honest. But I would also suggest GI video lectures as well. I will need some more time to predict the cutoffs. I'm still going through the questions. I also need a couple of volunteers to help me. So you guys feel free if you want to help me do the recalls. I need a couple of volunteers. So if you guys are willing to do, just text me personally on my you. Most of you have my phone number as well. So just text me personally, and I'll be taking your help to do the search test NEET assess recalls. I'll conduct a separate session where we can discuss the recalls as well. So yeah, registration for INSS, I genuinely don't know. To be honest, there used to be a time when I used to try to speculate all these stuff, but I've realized that mm, I can predict elections better than when the next registration of NEET SS and INISS dates. So I struggle to understand the system totally. I've been in the system longer than what you can imagine. I've been teaching people for NEET SS, INSS for a pretty long time right now. But even then, I've also completed my MCH. But even then, I struggle to find out when the dates are going to release. See, it's going to be difficult if you're working, but it is possible. I have personally done it myself. Um, I used to write entrances just to get the questions about at least till 2 years ago. And I think it's possible if you're working, but you need to have a good, strong fundamental idea. You should not be in a position where, see, you should have at least enough knowledge about rectal cancer that, that, first line is radiotherapy. After that, you go for surgery. That basic idea, if you have, then if you are able to spend 5 to 6 hours a day, then it's good. But if you are, completely clueless about malignancy, GI surgery, if you understand what is the difference between NISS and Tupe, little bit, then you can crack it. Then you need to spend 5 to 6 hours a day. But if you don't know what is NISS and what is two-pace, then you need at least 10 to 12 hours a day for the next 20 days. What is the complete duration? It's going to be almost 25 to 30 hours. And almost, to be honest, I don't know the exact duration. It's going to be at least 30 hours for sure. So I'm going to end the meeting right now. I'm going to summarize it. First, let's start with GI surgery. Repeating it again. Don't waste time reading Bailey and now again. Spend some time. What do you call it? Solving the Surgtest general surgery MCQ bank. That's going to be the general surgery strategy for both GI and Onco. For GI surgery specifically, if you have time, do tables from Shackleford and Blumgart. If not, leave it. But most importantly, because the tables are also covered in the video lectures, use the video lectures judiciously. It's about almost around 30 hours, I guess. That's going to be the crux of your preparation. But more important than that, the GI surgery MCQ bank. If you're able to solve it at least once, you are in a super, super strong position. For Onco, we have temporarily deactivated the video lectures because the video lectures is semi-updated. 90% of the content is relevant. 10% of the content needs to be this thing. I'm going to reactivate it because a lot of people have been asking me. I have at least received 15, 20 messages that they want the old video lectures again. I'm going to be reactivating it, but the MCQ bank is super updated. Solve the MCQ bank at least once. To understand concepts, especially in breast, thyroid, which is super detailed in the video lectures, use the video lectures. So that is the summary of the strategy. And for surgical onco, I would advise you strongly read MD Anderson 7th edition. It's a very easy textbook to read. Sorry. And it can be covered in the next 15 to 20 days. So yeah, 1 minute. So Mahima has asked me whether it's 1900 or this thing. Let me just check what for a second. I think I confused it to the general surgery part. It's around 2000 questions, if I remember right. Sorry. It's not 3000, it's around 2000 questions for the GI surgery part. It's around 2072 questions. Yeah. It's not 3000, it's around 2072 questions. Okay, guys. Thank you so much. Have a good day. I really hope you guys do really well and proud of you all. I'm sure you all will crack your entrance with a lot of ease. Okay. Thank you.